Hello, coders, and good morning, good evening, good afternoon, all depending upon where you're joining us from. And how are you all doing, coders? Let me know. How are you all doing? And welcome you all to the Evaluation and Management Tuesday Group Study Week 3 presented by AMCI. Okay, everyone. I see in the chat everyone doing good. For some, it's good morning. Yes, it's good morning for me. For some, it's good evening. Yes. So we are back with the week 3 evaluation and management group study after successfully completing the week 1 and week 2. We did cover a lot of topics and learned a lot of guidelines on E&M, and we did also did few of the scenario. So as I promised, we are back to the week 3 with the week 3 with new scenarios, with the new challenging scenario. So the question is, are you all ready for some challenging scenarios? I am ready with the scenario. So are you ready for them as well? Yes. So let's start. Let's not waste any more time and let's start the week 3. So I will start by, yes, intern interaction. Yes. So I will start by introducing our fabulous intern. As I always say, they are the backbone of Tuesday Study Group. Let me introduce Ms. Tanya, Miss Karen, Miss Sandra, and Miss Stephanie. So they are the people who are in the chat encouraging you, answering your questions. So a warm welcome to the intern team. And we have Mrs. J, AMCI Curriculum Director with us, and that's me, your instructor for Tuesday Study Group. So let's start with a few introduction points. What keywords to highlight for E&M documentation? We use to highlight the age of the patient, the diagnosis, the signs and symptoms, exams, the procedure, anything that the doctor does, and total time, the medical decision making, and data reviewed. So how to select the E&M code? We do ask few questions or do the following: whether there is a medically appropriate history or exam performed, the location of the visit, whether it's an office visit, inpatient visit, emergency visit. So depending upon the location of the visit, the type of the visit, whether it's a new patient or an established patient, the total time of the visit, medical decision making, E&M tables to select the code, and finally apply all the guidelines. So yes. So how to select an E&M code based upon the time? Once again, we will ask similar questions, but when total time is documented, one of the point we won't consider. Yes, we will ask whether medically appropriate history is performed, location of the visit, the type of the visit, total time of the visit. So when total time is documented, we are not going to consider the point 5, and we'll jump to point 6, which is E&M table, to select the code and apply all the guideline. Now, how to select an E&M code? Yes, how to select an E&M code when there is no time documented. So questions again remains the same: history, exam, whether it's performed, location of the visit, type of the visit, whether it's a new patient or an established patient. So in this case, there will be no total time documented. So what we will do, we'll go to the step 5, we'll skip the step 4 and we'll go to the step 5. We will inventory the MDM, and then we will be scoring them, and we'll use the E&M table to select the code, and finally apply all the guidelines. So that about selecting an E&M code. So review and score the documentation for MDM. So as you all know, we score the MDM by using our PDR chart, which we call in AMCI. So what's P stands for? P stands for the number and the complexity of the presented problems, and D stands for the data. Yes, D stands for the amount, complexity of the data reviewed, and R stands for the overall patient risk. So that's what a PDR chart is. And we have a new PDR chart, and that is available in your NCG manual. So you can see a lot of new codes has been added from the previous version, you have office visit codes, hospital observation codes, consultation codes, nursing visit codes, home visit codes as well added to the latest PDR chart. Yes, so where can you find the PDR chart? It is available in your MCG manual. So go and grab your MCG manual and check the PDR chart. So previously, coders, we covered home visits, medical team conferences, preventive medicine, medical care plan oversight, and we solved scenarios. So we also covered neonatal intensive care visits, care management, transitional care management, and standby services. So goals for the presentation today, goals for class today. As I said, I have brought some E&M scenarios based on what we have studied so far, and let's go straight into those scenarios. So this is your scenario one, and this time I have given you 3 minutes to solve the cases. So I would invite Miss Stephanie to read the first scenario for you all. Miss Stephanie, please, and thank you.
Thank you, Mr. Sandeep. Hello, and so happy to have you here, coders. What E&M code is reported for Dr. Thompson service? A 99203, B 99213, C 99204, D 99214. Mr. Chris, a 55-year-old farmer, presents to his PCP, Dr. Thompson, with complaints of persistent cough and shortness of breath over the past 6 months. Patient smokes one cigarette daily for last 15 years. His symptoms exacerbates after physical activity in the field. Comprehensive examination was performed. Doctors ordered chest x-ray and pulmonary function tests to investigate the underlying cause. Chest x-rays was reviewed and reveals an interstitial pattern. The interpretation of pulmonary function tests indicate reduced lung volumes. After a thorough investigation, the Dr. Thompson diagnoses him with idiopathic pulmonary fibrosis exacerbation. Dr. Thompson discussed the case with senior pulmonologist at Central Hospital and decided to refer Mr. Chris to him. What E&M code is reported for Dr. Thompson's service? Your time begins now. I wish you the best.
So, Curtis, how are you doing? How are you doing on the scenario? Let me check the chat. Okay. So it seems like you all have accepted the challenge. And let's solve the scenario. Let's highlight the keywords here. Skyline Clinic. Mr. Chris, a 55-year-old farmer, persisting dry cough, shortness of breath, comprehensive examination, chest x-ray, pulmonary function test, chest x-rays reviewed, interpretation of pulmonary function test, indicate reduced lung volume, idiopathic pulmonary fibrosis exacerbation is what the diagnosis is. Dr. Thompson discussed the case with senior pulmonologist at Central Hospital and decided to refer Mr. Chris. So the correct answer is going to be, as most of you have said, it's going to be 99214. And yes, here are the questions which we are supposed to ask ourselves. Whether a medically appropriate history or exam performed. Yes, there is a medically appropriate history and exam performed. Location of the visit. Now, this is an office visit. Type of the visit. Is it a new patient or an established patient? Coders. Yes, this is an established patient scenario. Yes. Exactly. It's not mentioned it's a new patient. This is an established patient. So that would eliminate option A and option C because both two codes are for a new patient office visit. So option A and C are eliminated, remaining option B and option D. So there is no total time documented. So what we are going to do, we are going to inventory the MTM and then score. So these are our diagnosis, the signs and symptoms which we have. Idiopathic pulmonary fibrosis exacerbation, that's what patient was diagnosed with. And in procedure, we have a medically appropriate history and exam performed. A chest x-ray was ordered and reviewed. Pulmonary function test was ordered and an interpretation was carried out. And finally, there was a discussion of the PFT, which is pulmonary function test, with Dr. With a pulmonologist of Central Hospital. Yeah, the case was discussed with a pulmonologist at Central Hospital. So that's all we are having, coders. And let's now start leveling. So where do you think, coders? Where do you think an idiopathic pulmonary fibrosis exacerbation will fall in the problem column? Let me know in the chat. Yes, it is someone saying it's moderate. So where exactly which one would you exactly pick in moderate? Okay, so everyone is saying moderate. Exactly which one which will you select? Yes, that's what I was looking for. You go for one or more chronic illness with exacerbation. Exactly. So it's a moderate problem. And now let's move on to the data. How about data quiz? Let me know. How about data? Where will it falls in a data column? Okay. So I see everyone saying it's a moderate. So anyone with a different opinion? Okay, everyone is saying a category for category level 4 moderate. So I would pick it as a high data. You know why, coders? To pick a high data level 5, you must satisfy two of the categories below. So in the category 1, I can see there is a 4 points which has been satisfied. We have a chest x-ray which is ordered and reviewed. We have a PFT, pulmonary function test, which was ordered and the interpretation was carried out. So that would satisfy category 1. So 4 points has been met in category 1, and you only needed 3 from the following in category 1. So that means category 1 is a tick. And I also see a discussion with a pulmonologist. Have you also have seen that line? Dr. Thompson discussed the case with a senior pulmonologist in a at a central hospital. So I would take that under category 3 as well. Discussion of the management or test interpretation with an external MD or qualified healthcare professional, appropriate source reported. So I have two categories satisfied in level 5. So I would take it as a level 5 data. Do we agree, coders? Yes. So is it clear? Shall I move on to the risk? Yes. So let me move on to the risk. In risk, what do you pick? Which column would you pick? Which level would you pick in the risk? Exactly. It is a low risk. It is going to be a low risk because only work which was done by doctor has referred the patient. So I would also pick a low risk, which is a straightforward. No, I'm sorry. I would pick a straightforward because nothing has been done. It's just a referral. So I would take it as a straightforward risk. Now let's finally do the leveling of the MDM. So I have a moderate problem, I have a high data, and I have a straightforward risk. Even if it's a low risk, it doesn't make much difference because the final ENM level is going to be 99214. Yeah, it is going to be level 4 ENM. And that's how I eliminate option B and I select option D as correct answer. So how are you feeling, coders? Are you feeling good? Did the explanation help? Let me know in the chat, coders. If you need any help, let me know. Yes. So everyone feels seems good, and let's move on to the next scenario. So Miss Stephanie will be once again coming back and reading this second scenario for us. Stephanie, thank you, and please and thank you. Okay, it looks like Miss Stephanie, are you still there? So I think it looks like Miss Stephanie is facing some technical difficulty. So I am going to read the second scenario for you all. So here are the options. Option A, 99203. Option B, 99213. Option C, 99204. Option D, 99214. A 67-year-old male, Mr. Brown, presented to the cardiology department of Central Hospital for the first time with complaint of ongoing fatigue for the past 3 weeks. He explains that he has been facing an increasing shortness of breath during simple activities. Additionally, he noticed swelling in his legs, which he never experienced before. The interpretation of external echo report from another facility was done by the cardiologist, which indicate reduction in left ventricular function. Chest x-rays ordered revealing fluid accumulation around the lungs. B type natriuretic peptide blood test ordered and reviewed. Based on the gathered evidence, Mr. Brown is diagnosed with chronic congestive heart failure. What ENM code is reported for the cardiologist service? So once again, coders, you have got 3 minutes to answer this question, and your time starts now. And that is 3 minutes. And what I see from the chat, there is a split. Yes, there is a split between option A and option C, which I see. Okay, let's solve this one code. This let's solve this together. So the keywords here is going to be 67-year-old male, Mr. Brown, presents to the cardiology department of Central Hospital for the first time. So that means that he is a new patient for the complaints of ongoing fatigue, shortness of breath, swelling in his left, swelling in his legs. Interpretation of an external echo report from another facility was done by the cardiologist. A chest x-ray is ordered and accumulation around the lungs was seen. A p-type natriuretic peptide blood test ordered and reviewed, and the final diagnosis is a chronic congestive heart failure. So what is the ENM code reported for the cardiologist services? So once again, let's start by asking the questions. Whether a medically appropriate history or exam was done? Yes, there was medically appropriate history and exam performed. Now, what's the location of the visit? This is an office visit. Type of the visit, you already said this is a new patient because the patient is visiting the hospital cardiology department for the first time. And total time, there is no documentation for the total time. So all we have to do is we have to inventory and then score the MDM. And in diagnosis, signs and symptoms, we are having a chronic congestive heart failure. And in procedure, we are having a medically appropriate history and examination performed. Interpretation of external echo report was done. A chest x-ray ordered and reviewed. A B-type natriuretic peptide blood test ordered and reviewed. So let's take our PDR chart and let me look into the chat for your answers. Which one would you pick in problem column? Where do you select the chronic congestive heart failure in the in the problem column? Come on, coders, let's make this one an interactive session. And okay, I can see people saying moderate. So coders, can you be more specific under moderate? If you're selecting moderate or if you're selecting low, which is the category which you're selecting? Whether it's a chronic illness with excess separation or two or more chronic stable, which one are you picking? Okay. Okay, so I would pick chronic congestive heart failure and a low problem here because there was no excess separation which was documented by the doctor. He just diagnosed the patient to have a chronic congestive heart failure. So I would take it as a stable chronic illness for the moment, because in the last scenario you have seen the doctors clearly documented that there was an excess separation of the disease, and here Mr. Brown is diagnosed with just a chronic congestive heart failure. So let me take the data column. Yes, so I would pick as a stable chronic illness, and that would be a low problem. And how about data coders? What do you select in data column? Okay, so in data, what I would select is that I would select it as a high level data reviews. Once again, you can see a chest x-ray which was ordered and reviewed. So that's a 2 point over there. You can see B-type natriuretic peptide test which is ordered and reviewed. and again there's a 2 point over there. So that is total 4 points in category 1 under high level data. Do you agree, coders? So that's a category 1 high level data has been, that's a tick mark for that. And what do we have other than that? We have an interpretation of an external echo report. So where does that fall? Yes, it will fall under category 2, where independent interpretation of tests performed by another MD, qualified healthcare professional, or appropriate source. So that also satisfies category 2. And to select high level data, I just need to satisfy 2 of those categories. So category 1 has been satisfied, category 2 has been satisfied. That means I can select a high level data. Am I correct? Do you agree with me, coders? Yes. And in the risk, what has doctor done? What has doctor done? There's nothing in the risk which doctor has done in this scenario. Yes, doctor hasn't done mentioned anything. Maybe he might do something later on, but at the moment, from the data which we are having, documentation which we are having, doctor hasn't done anything. So I would select a straightforward risk for the scenario. Once again, throwing the lowest level out and selecting the next level, I would select it as a low risk. Yes, level 3 risk, and the ENM code, it would be 99203. Okay, let me quickly grab the chat and let me look into the questions. Okay, someone has asked about the data column. So you can see there is 4 points already satisfied in the category 1 in a high level data. So let me take the pointer. One second, Curtis. Yes, you can see over here we have an ordering of a unique test, which is chest X-ray. We also had an ordering of a unique test in beta B type natriuretic peptide test. So that is 2 points over there. And we had a review of chest x-ray. Also we had a review of the lab test, which is beta type natriuretic peptide blood test. So that's total 4 points satisfied over there. So that means that we only needed any 3 from the following. So we have already having 4 points here. That's a tick mark for category 1. And in category 2, we are having independent interpretation of the test, which is performed by another MD, qualified healthcare professional, and appropriate source, which is interpretation of an external echo reports. So that satisfies category 2 as well. So we have category 1 satisfied, category 2 satisfied, and if you look under the parenthesis for high data, we just needed to satisfy 2 categories from the below. So we had category 1, category 2, that's both has been satisfied. So we would select high data for the scenario. So is that clear, Codis? Okay. Okay. Yes. Yes. So the ENM level for this scenario would be 99203. So someone did said that there is a swelling in the legs, a shortness of breath. Would that indicate an exacerbation of chronic congestive heart failure? So it is not us to decide whether the condition has been exacerbated or not. As coders, what we have to do is look into the documentation and code accordingly. So if the doctor has said the condition is worsening or it is exacerbated, go ahead and pick depict it as a chronic condition, exacerbated or worsened. But if he is not mentioning them, let's not assume that those are notes, or let's not guess whether it's an exacerbation or not. Let's not touch doctors, what doctors should have been documented. So is that good, coders? Does the explanation help? Shall we move on to the next scenario? Okay, so thank you, Miss Stephanie, for reading the first scenario for us. I hope she is back. And let's move to the next one. Let's move to the scenario number 3. And I think it's Miss Dania who's coming to read the scenario for us. Miss Dania, please, and thank you.
Thank you, Mr. Sandeep. Uh, what E&M reported for Dr. Jennifer's service? Option A 99396, 99294, modifier 25. B 99386, 99203, modifier 25. 99396, 99213, modifier 25. Option D 99386, 99202, modifier 25. Mrs. Susan Miller, 45-year-old female, present to Mr. Dr. Jennifer for periodic annual physical examination. Jennifer, Dr. Jennifer performed a comprehensive preventive evaluation and management service during this visit. She reviewed the patient's medical history, including family history, past surgeries, and current medication. Dr. Lee conducted thorough physical examination assessing vital signs, general appearance, heart, lungs, abdomen, and extremities. Miss Susan complained of sore throat for last 1 week. With the help of tongue depressor, Dr. Lee carried out in specific of the throat. Tonsil size appearance looked normal. Posterior wall of the throat, oropharynx, Vula was inspected for abnormalities. Pharynx appeared inflamed. Throat swab sent out to return positive for streptococcal pharyngitis, and amoxicillin was prescribed. The physician discussed health maintenance topics with the patient, including diet, exercise, smoking cessation, and alcoholic consumption. Counseling and education were provided regarding the age appropriate cancer screening, immunizations, and other preventive measures. Lee updated patients' immunization required and recommended a tetanus booster. Your time start now.
And I see you all are picking up the pace and you're doing a fantastic job leveling those scenarios. Great job, coders. So let me highlight the keywords for this scenario. We have a 45-year-old female, Miss Susan, here for a periodic annual physical examination done by Dr. Jennifer. And Dr. Lee conducted a thorough physical examination. Miss Susan complained of sore throat for last 1 week. Dr. Lee carried out an inspection of throat. Throat swab was sent out, returned positive for streptococcal pharyngitis, and an amoxicillin was prescribed. So let's ask the questions. Coders, what are we coding here? We are coding for Dr. Jennifer's service, and we are coding for a periodic annual physical examination. So for a periodic annual physical examination, let's ask few of the questions. Is this our FTR for preventive medicine fix? And where did I got this from? I got this from our MCG manual. So let's ask the question. What's the age of the patient? Patient is a 45-year-old female. Is it a new patient or an established patient? It's an established patient. You can see it's for a periodic annual physical examination. That means it's not an new patient. Additional DX worked up? Yes, there was an additional diagnosis for which workup was done. And if yes, use 25 modifier for additional workup, append 25 modifier to the office outpatient code. So you can see there was an additional workup which was done by a Dr. Jennifer. You can see there was a throat examinations which was performed that was separate from a regular annual physical examination, and a throat swab was also sent out. And finally, a prescription management was also done for the condition that was a streptococcal pharyngitis. So definitely there was a workup done for an additional diagnosis. So all we have to select an periodic annual physical examination code as well as an office visit code, and then append a 25 modifier to it. So is it clear so far, coders? Yes. So let me start eliminating the wrong answers. So I would eliminate option B and D right away. You know why, coders? Because both are coding for an initial comprehensive preventive medical physical examination code. So we didn't had an initial comprehensive exam. We had a periodic comprehensive preventive exam. So that was not a new visit. That was an established visit. So that would eliminate option B and D, and the correct code would be 99396, which is for periodic comprehensive preventive examination, age 40 to 60 years. And the age of the patient, why was it important? It's because of this reason for the correct code selection. So we are having 99396 as a correct code. So what's our duty next? Next, we have to select the correct outpatient code. We have to select the correct level for the outpatient service which was performed here. So that's what differentiate between option A and option D. So still, let's ask these questions. Was there a medically appropriate history done? Yes. There was a what was the location of the visit? Was an office. What's the type of the visit? It's an established patient. Total time not documented. And let's inventory MTM and score. So diagnosis, we are having streptococcal pharyngitis. Procedure inventory, what are we having? There was a throat swab which was done and sent out. And prescription management was also done. There was an amoxicillin prescribed. So coders, once again, question to you: what do you select? Which one would you select in column table? I'm sorry, in the problem column. Okay. Mhm. Exactly. I would select it as a acute uncomplicated illness or injury. So I would take streptococcal pharyngitis as an acute uncomplicated illness or injury. Correct. Correctly said, Codis. So how about the data? What do we have in the data? Okay. Come on, Codis. I expect more participation from you guys. Come on, Codis. Yes. Okay. So in data, I would take it as a low data, as most of you have said. We had a throat swab which was sent out, and that turned out to be positive for streptococcal pharyngitis as well. So I would take it as in the category 1, low data. And in risk, how about risk orders? Okay, moderate risk. Why would I select moderate risk? Exactly. There was a prescription management which was done. Yes, you all are correct. There was a prescription management which was done. So that would be a moderate risk. So throwing out the lowest level, selecting the next highest level, the correct ENM code would be 992. What it would be? Yes, it would be a 99213. So leveling final level code would be 99213. And the correct answer is 99396 and 99213 with a 25 modifier, and that would be option C. So how are you feeling about this scenario? How are you feeling, coders? Are you feeling okay, good, great? Let me know in the chat. So if you have any queries, please let us know in the chat. If you want to take a screenshot of the scenario also, you can have it. Yes. Yes. So you guys are now changing the gears, and we have a scenario for. So let's welcome Miss Tanya once again to read the scenario for us.
Hello, Codel. Mr. Joe, first, mm, Mr. John Smith, a 6-year-old male, presented to ED complaining of severe crushing chest pain started suddenly about 2 hours ago. He described his pain as 9 out of 10 in intensity, radiating his left arm. He also reports nausea and dysphoria accompanying the pain. The patient denies any recent trauma or other significant symptom. ED physician Dr. Emily Rodix performs a comprehensive history and exam. He orders EKG and troponin. IVS is established and aspirin, nitroglycerin, and morphine administered per chest pain protocol. Patient troponin came back as positive and EKG indicates ST elevation. Dr. Emily Rodix discussed case with a cardiologist on duty and decided to admit for emergency PTCA and future patient care. He has diagnosed with myocardial infarction and part Yandam code reported for Dr. Emily's service. The time start now.
And that is 3 minutes. Chorus. Thank you, Miss Denia, for reading last two scenario for us. And yes, there was no options for this scenario, Chorus. So this was a challenge for you all. And I can see from the chat that you have done pretty good job with the scenario and the challenge. Yes, so the keywords here: Mr. John Smith, a 60-year-old male, presented to the ED with a chest pain. ED physician Dr. Emily Rodriguez performed a comprehensive history and exam. She orders an EKG and troponin. IV access established, aspirin, nitroglycerin, morphine administered. Patient's troponin came back as positive, and EKG indicates ST elevation. Dr. Rodriguez, Emily Rodriguez, discussed the case with cardiologist on duty and decided to admit the patient for an emergency PTCA. Oops, emergency PTCA, as he was diagnosed with myocardial infarctions. So that's all the keywords which we are having. So coders, if you want to take a screenshot, go ahead and take it. So I will give you a couple of seconds to take the screenshot. Okay. So what are we having? What are we coding here for coders? We are coding for an emergency department visit. We had an ED visit in the scenario. So these are the questions, and these are the answers. Was there a medically appropriate history or examination performed? Yes, there was a medically appropriate history and exam performed. What was the location of the visit? It was an ED visit. Yes, it was an ED visit. And what's the type of the visit? Is it a new patient or an established patient, coders? Yes, that was a tricky question for you all. It doesn't matter whether it's a new patient or an established patient. Yes, you all are smart. So that doesn't matter if it's a new patient or established patient, because it's an emergency department visit. And in emergency department, we don't consider whether the patient is we don't look into whether the patient was a new or established. And there was no total document time also documented, and that's not important in our scenario. So in the diagnosis inventory, we are having myocardial infarction, and in the procedure inventory, we are having EKG ordered and reviewed. We are having troponin, which was ordered and reviewed. We have a discussion with the cardiologist, and finally admission to the hospital for a PTCA. And where do you pick myocardial infarction in a problem column? Yes, high is what everyone is saying. High problem, level 5. So which one in level 5? Yes, I would take it as an acute or a chronic illness with injury that, or any injury that poses a threat to life or bodily function. Exactly. That's where I would pick in problem column. And let's have a look into the data. Next comes the data coders. Okay. Yes, exactly. I would select it as high data level 5. Once again, to satisfy high data, we have to satisfy two or more categories from the level 5. We have an EKG ordered and reviewed. We have a troponin ordered and reviewed. That's a 4 points, and that would satisfy a level category 1. And we also had a discussion with the cardiologist. So that would be a discussion of the management or the test with a external MD or qualified healthcare professional or appropriate source. So that would be category 3. So I have category 1 satisfied and category 3 satisfied in a high level data. And that is high level data. How about the risk coders? How about the risk? Once again, it's high. I can see all in the chat. So why it's a high risk scenario? hmm I see some beautiful answers in the chat. Exactly. You guys now are in next gear. You guys are in top gear at the moment. Exactly. Yes. After a couple of scenarios, now you all are doing phenomenal work here. Superb. Exactly. So I would take it as, you can take it as an decision regarding or emergency or a emergency major surgery, or you can take it as a decision regarding hospitalization or escalation of hospital level care. So I would take it as a decision regarding hospitalization because the case was discussed with the cardiologist and it was decided to admit the patient to the hospital for a PTC. Exactly. Exactly. Awesome answers in the chat. So that would be a high problem, a high data, and a high risk. And what would be the E&M code? It would be 99285. Exactly, coders. Awesome job in the chat. Great work. So how are you feeling now, coders? How are you feeling? I see you are doing a great job in the chat. How are you feeling? Are you feeling better now solving the level E&M leveling using the PDR chart? Because I see you are picking correct answers in the chat. You're putting them in the chat. Yes, feeling good. Yes, practice makes perfect. Exactly. So let's move on to scenario number 5. And once again, thank you, Ms. Danya, for reading scenario 3 and 4 for us. And now let's invite Miss Sandra, who's coming to read the scenario 5 for us. Miss Sandra, please, and thank you.
Thank you, Mr. Sandeep. Hello, coders. Let's look over the answers first. We have A, 99234, B, 99234, 99238, C, 99221, 99238, D, 99222. Mrs. Mrs. Mary Johnson, a 65-year-old female, presented to the hospital at 9 a.m. in the morning with complaints of weakness, dizziness, and decreased urine output for the past 24 hours. Dr. Xavier elevated the patient. She reports feeling lethargic and experiencing dark, concentrated urine. No significant diarrhea, vomiting, or other symptoms were reported. The patient appears weak but alert. Skin and dry mucous membranes, tenting of skin. Labs ordered, including complete blood count CPC, electrolyte panel, and renal function tests. Urinalysis performed indicating concentrated urine. Patient was diagnosed as mild dehydration due to insignificant fluid intake. Patient educated on the importance of fluid intakes and signs of dehydration. Dr. Xavier admitted patient for rehydration therapy for 1 hour. IV access established and normal saline started. Upon completion of normal saline drip, patient was discharged home at 6 p.m. on the same day. Both admission and discharge took place in single encounter. What EM code is reported for Mr. Xavier's service? Your time starts now.
and that is time. And I can see all alphabets in the chat. I can see A, B, C, and D. So this one is going to be a teachable moment. So let's highlight the keywords here. We have Miss Mary Johnson, 65-year-old female, presented to the hospital 9 a.m. in the morning with complaints of weakness, dizziness, decreased urine output. Dr. Xavier evaluated the patient, labs ordered including CBC, electrolyte panel, renal function test, urine analysis also performed. The patient was diagnosed with mild dehydration due to insufficient fluid intake, and Dr. Xavier admitted the patient for rehydration therapy for 1 hour, discharged home at 6 p.m. on same day. Both admission and discharge took place in single encounter. So what is the E&M code reported for Dr. Xavier's service? And the correct answer is going to be option D, 99222. Why is a question everyone is asking in the chat at the moment. And yes, this is the reason why I selected option D. So what is the question here? The question is, what is the E&M code which is reported to Dr. Xavier's service? And what did the Dr. Xavier do? There is an admission. Dr. Xavier admitted the patient, and there is also discharge to the home on the same day. And there's also another sentence which stating that both the admission and discharge took place in a single encounter. So that's very important thing which that is mentioned in the scenario here, because if you go and look into the hospital inpatient and observation service guidelines, it's clearly state that codes 99234, 99235, 99236 require two or more encounters on the same date, of which one of these encounters is initial admission encounter and another is being discharge encounter. For the patient admitted and discharged at the same encounter, that is one encounter, see 99221, 99222, 99223, and do not report 99238 or 99239, which is discharge service codes, in conjunction with 99221 and 99222, 99223 for admission and discharge performed on same date. So the last guideline that would eliminate option C right away. Option A is also incorrect because, as the guidelines state, to bill 99234, there must be two encounter. There must be one admission encounter and there must be one discharge encounter. So there must be two encounters total. And if there is only single encounter, when the admission and discharge took place in single encounter, that is one encounter, the guideline states go and code for 99221 to 99223. So option A is incorrect, option B is incorrect, and option C is also incorrect. That would lead us to option D, 99222. So how are you feeling, Chorus? Are you feeling good so far? Let me know in the chat. Because yes, great, great, good. So I hope you see where you got wrong for this scenario. Yes. And still, let me show how to level this scenario. Let me show how I can get 99222 as correct answer. So join me in the chat, coders, and let's do E&M leveling for this one. So where do you think, coders, it will fall under problem column? Join me in the chat. Where do you think it will fall in the problem column? Mild dehydration, there was a stark concentrated urine, lethargic, weakness, dizziness. What do you all think? Don't worry if you get it wrong. We all are studying together, learning together, coding together. That's the purpose of study groups. Yes, so I can see Mini has placed it as a low. Okay, low. So I would take it as a moderate. You know why, coders? would take as a acute illness with a systemic symptoms, because there's a dehydration. You can see the systemic symptoms such as a dark concentrated urine, lethargy, weakness, dizziness, decreased urine output. So I would take it as a yes, I would take it as an acute illness with systemic symptoms. That would give me a moderate problem. And how about the data? What the data is. So I have a CBC, I have an electrolyte panel, I have a renal function test and urine analysis which has been ordered. So there is 4 tests which has been ordered. So data, I would take it exactly. So great work once again. I'm so happy seeing the way you are leveling this E&M scenario. So that would be a moderate data, that would be level 4. And how about the risk? How about the risk coders? Exactly. That's a moderate risk. You can see there's an IV normal cell line which was given. So that would take it as a prescription management once again. So that would give us an E&M level of yes 99222. Yes, exactly. So I see great answers in the chat. So shall we move on to the next scenario chorus? Yeah, so let's see what we are having next. And Miss Sandra will be coming once again to read the scenario 6 for us. Miss Sandra, please and thank you.
Sarah Mitchell, 55-year-old female with a complex medical history and multiple chronic conditions, is scheduled for a routine follow-up appointment with their primary care physician. During the visit, it becomes apparent that the patient has several new health concerns and requires an extensive evaluation and management. The physician spends a significant amount of time discussing the patient's medical history, reviewing test results, conducting a thorough physical examination, and developing a comprehensive treatment plan. Patient was diagnosed with unstable hypertension, diabetes mellitus, and new onset of migraine. Doctor adjusted medication dosage for above conditions and spent total time of 68 minutes on this visit. What EM code is reported for PCP service? Your time begins now.
and that is time. So once again, you all are rocking in the chat. So this was also a challenge scenario. I didn't give you any options just to see how are you going to do this one. So you all have done a phenomenal work, coders. So thank you, Miss Zania, for reading last two scenarios for us. So here are the keywords: Miss Sarah, Michael, 55-year-old female, routine follow-up appointment, physical examination was performed, patient was diagnosed with unstable hypertension, diabetes mellitus, new onset of migraine, and we had a 68 minutes of total time spent for this scenario. What E&M code is reported for the PCP service or the doctor service? And let's solve this one. So what E&M code is reported for the doctor service is the question. So let's see. The total time has been documented in this case. So this is an office visit, and there was an office visit. So let's ask the question whether there's a medically appropriate history or exam performed. Yes. Location of the visit, it's an office visit. Type of the visit, this is a new or established. This is a routine follow-up appointment. So this is an established patient. Total time documented, 68 minutes of total time has been documented in the scenario. So let's see what 68 minutes of office visits is coding for. So we have 99215, which is for a 40 to 54 minutes of total time spent on the date of encounter. Well, we are having 68 minutes here. So I think it's a prolonged service, isn't it? Isn't it? It's a prolonged service. So yes. So we have to look into the code 99417, which is for a prolonged outpatient evaluation and management time with or without direct contact, each 15 minutes of total time. And also it states do not report 99417 for any time unless until a unit less than 15 minutes. So we had a 68 minutes of total time service, total time documented in the scenario. So what I will do is I will go to the chart. I will go to the prolonged service chart, and I will just see where does the 68 minute of total service fits into. So yes, I see that it fits into over here. As you can see in the chart, it will fit between 55 minutes to 69 minutes. So I would select an E&M code of 99215 and 99417. No, we cannot code a prolonged service outpatient visit with a E&M code of 99214. So how are you feeling, coders? How are you feeling? So in the parenthesis also you can see over here, yes, use 99417 in conjunction with, yes, over here 99205, 99215, 99245, 99345, 99350, and 99483. So this is a prolonged visit, and using the time documentation, using the chart over here, we can pick the correct answer. So that would be 99215 and 99417. Okay, so someone's mentioned it's a learning moment, it's an aha moment. Yes, I didn't consider time. So as you can see, time documented, go with the time. So shall we move on to the next scenario, coders? Did the explanation help? Do you want any more explanation on this scenario? Shall we move to the next scenario, coders? Yes, good. You guys are rocking, by the way. You guys are doing a phenomenal job. So let me move on to the next scenario, number 7. And it is going to be Miss Karen who's coming to read the scenario 7 for us.
Good night, everyone. Scenario 7. Edward, a 59-year-old school principal, present a neurologist, Dr. Alex, with tremors in his right hand that have been progressing over a year. Dr. Alex is seeing Mr. Edwards for the first time. The tremors is more pronounced when his hand is at rest. Neurological examination also reveals brachythysis, I butchered that word, and a stiffness goit. There is a positive family history for similar symptoms. Based on the findings, the neurologist diagnosed Parkinson's disease. Dr. Alex decided to start medication therapy with levodopa 250 milligrams 3 times a day for 2 months. Mr. Edwards advised to follow up after 2 months to check his progress. What EM codes is reported for Dr. Alexis? Good luck, guys.
Okay, Goddess. So what do we have here? What do we have here in this scenario? We have an 59-year-old Mr. Edward seen by Dr. Alex for the first time. That means that it's a new patient. Neurological examination was done, and the patient was diagnosed as a Parkinson's disease. A levodopa 250 milligram was prescribed for 2 months. So let's see the questions. We have a history, medically appropriate history and examination performed. The location of the visit, it is an office visit. The type of the visit, we already said it's a new patient, as Dr. Alex is seeing Mr. Edward for the first time. Total time documented, there is no total time documented for this service. As we have been doing all through the class, we are going to inventory the and we are going to do the inventory and MDM and score the MDM. So this is what we are having in the diagnosis: a Parkinson's disease. And how about the procedure? We're having a medically appropriate history and examination performed, and a prescription for levodopa. So now let's start leveling. Let's look into the problem column. So join me, coders, and what do you think Parkinson's disease fits in the problem column? Okay. Mhm. So please go ahead and be a little bit more specific while you're answering in the chat. Let me know, what are you picking? Whether it's a chronic illness, whether it's a chronic illness with excess abrasion, whether it's a moderate or low problem. Okay. Okay. So I would pick. Okay. So the patient here is diagnosed with Parkinson's disease. So I would take that as a stable chronic illness. So doctor hasn't mentioned whether it's an exacerbation or worsening of a Parkinson's disease, or nothing he has mentioned. It's just mentioned it's a Parkinson's disease. So that I would take it under one stable chronic illness in low problem. Do we agree, coders? Do you agree with me on that? Yes. Okay. Yes. So how about the data? Let's move on to the data. Okay. hmm So nothing has been done, or that no data has been reviewed here in the scenario. This is just a physical examination which was performed. No data has been reviewed. No test has been performed as well. So that would be a straightforward data level 2. Exactly. Exactly. As most of you have said, it's a straightforward data. And how about the risk? Yes, that is going to be a moderate risk. Exactly, correct answer. And so leveling the ENM, the ENM correct ENM code is going to be, it is going to be, yes, 99203. Exactly, exactly. So does the explanation help, coders? Let me know in the chat. So is that clear how we got 99203? Yes. Okay, so let's move on to the next scenario, scenario number 8. And I believe that's the last scenario which we are having, last challenge which we are having for the day. So let's move on to the next scenario. Once again, Miss Karen, it's all yours.
Good night again, guys. A, okay, sorry. What EMN codes is reported for Dr. Jackson newborn service? A 99221 99238, B 99460 99238, C 99234, and D 99463. Benjamin Smith, a newborn male live baby delivered at hospital, was seen by Dr. Jackson, neurologist at hospital, for his initial normal newborn care. The visit included a comprehensive evaluation of the newborn infant's health, physical examination, and discussion with the parent regarding infant care, feeding, and development. Baby is healthy and requires routine care, including a physical examination, newborn screening tests, and vaccinations. Benjamin Smith was, was discharged in the same evening from the hospital. Dr. Jackson spent 10 minutes giving discharge instructions and counseling on immunization was given. Parents advised to return to hospital in case of any complications. What EMM codes would is reported for Dr. Jackson newborn service? Good luck, guys. Let's finish strong.
So how are you doing, Coders? Let me quickly look into the chat. Okay, okay, you all are doing good, great here. So as Miss Karen said, you are ending this in all session on a great note. Yes, great work, Coders. Still, let's go through this scenario. Let's highlight the keywords. Benjamin Smith, a newborn male live baby delivered at hospital, seen by Dr. Jackson, who's a neonatologist, for his initial normal newborn care, a comprehensive evaluation performed of the physical examination done, discharged in same evening from the hospital. Dr. Jackson spent 10 minutes giving discharge instructions. What E&M codes are reported for Dr. Jackson's newborn services? So thank you, Miss Karen, for reading last two scenarios for us. So let's see what code options which are we having here. So what are we coding here for? We are coding for Dr. Jackson's newborn services. So once I repeat, we are coding for Dr. Jackson's newborn services, and the codes 99221 and 99234 all coding for initial hospital inpatient observation care and hospital inpatient observation care respectively, but we are having separate set of code for newborn care services given. Yes, these following codes are used to report the services that are provided to a newborn birth through first 28 days. So we are having separate newborn care services, so we won't be coding 99221 or 99234 at the moment for this scenario. And it's a normal newborn baby as well, so we won't be coding those CPT codes. So I can eliminate option A and option C straight away. And remaining two options are option B and option D. So let me have a look what option B is coding for. It's for 99460, which is an initial hospital or birthing care center per day for evaluation and management of a normal newborn infant, and 99238 is coding for hospital inpatient or observation discharge day management 30 minutes or less. And if you look into the parenthesis, which is just under the code description of 99239, it states that for discharge services provided to the newborns admitted and discharged on the same date, use code 99463. Now with that instruction, let's go back and see what was the scenario for us. Was the baby admitted and discharged on the same day? Yes, the newborn baby was discharged on the same day in our scenario. Am I correct, coders? Yes. So that means we have to go and look into option D, which is 99463, which is coding for initial hospital or birthing care center per day for evaluation and management of a normal newborn infant admitted and discharged on the same date. So the correct answer would be option D, 99463. Does the explanation help, coders? Are you feeling good? Okay, everyone is feeling good, amazing, great. So with that, we come to a conclusion of our week 3 study groups on E&M. I know this was a little bit challenging week because I did throw a few challenges to you all, but what I see from the response, you all accepted the challenge, and I believe you are feeling better on E&M coding and E&M leveling, especially using the PDR chart. We went through several scenarios. We went through different kind of scenarios, and we did E&M leveling. So great work, coders. Don't get disappointed or overwhelmed. Don't get disappointed if you got it wrong this week. Sorry, if you got wrong this week, no worries. It's a learning process, and practice, practice, practice. You will be doing great on E&M. And if you have got any doubts on the scenarios which we discussed today, or any E&M scenarios, please let me know. Reach out to me through the student success team. I will be always happy to assist you. So coders, if you have any queries, reach out to me. So till then, we will see you all next week. Till then, take care and goodbye. A good night for you all. So next week we will be probably having some E&M chun sessions as well. So stay tuned, coders. See you next week. Good night and take care.